At progression, this patient clearly is a candidate for systemic treatment. When considering systemic treatment, again, the only approved drug and has stood the test of time now since its approval in 2008 is sorafenib. Sorafenib is an oral multi-kinase inhibitor with activity against the VEGF receptor and has been shown to improve survival in patients such as this, specifically patients who have macrovascular invasion or patients who have extrahepatic spread or both. There's been numerous clinical studies challenging sorafenib, and no drug has been able to be approved in the frontline setting. With that being said, there are always drugs in development, and for patients like this who are well compensated and active, good performance status, they should be considered for a clinical study. Most of these studies would be sorafenib versus a new agent or the combination of sorafenib and a novel agent. What's interesting about the use of sorafenib in liver cancer is it is not a drug that induces a high response rate. The majority of its benefit is from inducing stabilization of disease and slowing progression. Typically, these patients are followed with a regular clinical evaluation to monitor for side effects, the most common being hand-foot skin reaction or GI toxicity and fatigue. Specifically diarrhea in regards to the GI toxicity. And these can generally be managed with prospective effort by clinicians, asking symptoms and seeing patients frequently and giving advice on how to mitigate these side effects. And as far as following their response to sorafenib, that becomes somewhat of a challenge because there is no response rate. Typically, these patients will be imaged at 2 to 3 month intervals, and really what we're looking for progression. The data with sorafenib that suggests that it improves survival, the SHARP study, was generated with a co-primary endpoint of both radiographic progression as well as symptomatic progression. So even though a patient may have some progression on imaging, data would suggest that if they are not having symptomatic progression, to continue them on sorafenib. There is no drug that's been shown to be of significant activity in the second-line setting. Nothing's been shown to improve survival. But again, this is an area of active clinical research, and if a patient has been on sorafenib, repeated scans over several weeks to months show continued growth of lesions or the development of new lesions, which are unequivocal. That is to say, again, on repeat imaging, they continue to grow. At that point, this patient could be considered to have progression and be referred for a clinical study if they would be a candidate. If the patient had some decompensation that would prevent them from going on to a clinical study, then it would be very reasonable to continue sorafenib as long as that they are of a condition and performance status that they should be considered for any treatment. Again, this is a patient who has presented with extrahepatic disease from the beginning, and likely their course of progression will be with the development of new lesions outside of the liver, as well as growth of lesions in the liver. And at some point, I would suspect may be a candidate for a research study.